The knee joint is the most common joint in the body where you end up with arthritis. You end up with arthritis there for a number of reasons. First and foremost, the knee joint itself is designed in a somewhat poor fashion. So in the knee joint, we have this flat surface on the tibia, the bone in the lower leg, and this rounded surface on the femur, the bone in the upper leg. And the most unstable joint in the body is your knee, because it allows for forward and backwards slippage as you bend and straighten for this to occur, and that friction then would wear away the cartilage and the meniscus in the joint. It also allows for side-to-side slippage in the joint, and so that would do the same thing. It would wear away the meniscus and the cartilage in the joint. In addition, we've got your kneecap, which should track up and down in this groove, and as you bend and straighten your knee, ideally the kneecap just tracks straight up and down. Most times in most people, what happens is at the same time that the knee is bending and straightening, the kneecap is actually shifting side to side, and that will start to wear away the cartilage on the femur as well as on the kneecap. So again, that side to side slippage, rotational slippage, all of which are the result of how the knee is designed and the muscles and things in it that wear away the cartilage on any of those surfaces. Arthritis starts early on in life. It probably starts to some degree if you're very active as a teenager. You start getting a little bit more friction, you're very hard on your joints, you play a lot of sports, you do a lot of activities, etc. And you start to create that a little bit of wearing on those surfaces. So if we're looking at the knee in general, you're beginning to wear that cartilage just a little bit. And what happens then is that you start to experience that tightness and that stiffness. So understand, those are the signs of arthritis. It is very possible to prevent arthritis from getting worse, but you can't reverse anything that's happened. So the earlier that you start addressing those symptoms, those signs and symptoms that I just mentioned, the stiffness, the aches, the swelling, etc., and prevent it from getting to a point where you've actually killed off the nerve endings, the earlier that you start to address that, the easier it is to prevent it from getting worse and stop it from having a negative effect on you. Because the last thing we want is for anybody to end up needing to have a joint replacement or a knee replacement. So again, you can prevent it from getting worse, and that's really where physical therapy comes in. We can help you to be active, we can help you to have this arthritis in your joint, but have it not affect anything. And how do we do that? We make sure the capsule is doing its job. We make sure the ligaments are able to do as much work as they can. We make sure that the muscles are strong enough to make up for what the ligaments don't do, and that they stop all of that slippage from occurring. Muscle can be strengthened if strengthened appropriately, correctly, and in the right balance of each other, and getting your hip muscles along with your quads and your hamstrings. We can make your knee be just as stable as it ever was and undo the further effects that any arthritis would have. We can make sure then that muscles are nice and loose and stretched out the way that they need to be, and we can most importantly make sure that your kneecap is tracking the way that it should, and all of that works together to stop all of that slippage, which ultimately is what causes the pain. So again, physical therapy and the expert physical therapist here at Loudon Sports Therapy Center can help you with that. We can get it all started by doing an assessment on what is causing your problems, figuring out exactly what of those 5 things is causing your arthritis, figure out if it is arthritis, and if not, figure out what needs to be done to handle it. And when we determine that it is arthritis, and you don't need an x-ray to figure that out, you can figure out arthritis by looking at those 5 things, seeing one of our expert physical therapists, getting everything assessed, figuring out if it's arthritis, and then getting you doing the appropriate things for it. And we can definitely help you to get it under control and get back to living life and being able to do the things you want to do without arthritis causing you to have problems.